grab your anti-burst ball. We're going to bring it under the sacrum, lying supine for quadricep work. Anchor your arm extensors by your side, pressing the triceps, wrists, and palms heavy into the floor. Dorsiflex one foot, sliding it out long on the floor. Guide your tailbone away from you, creating lumbar extension. Reach the sternum in and the back ribs, sternum in towards the spine, and the back ribs press heavy into the floor. From here, we're going to lift the extended leg up, 2, 3, and we'll lower on our inhale, 2, 3. Brace the abs to exhale, lift, 2, 3. Inhale, lower, 2, 3. It's very important that you're bracing your abs to keep the low back safe, and that you're keeping the foot dorsiflexed so we can combat that plantar flexion in the ankles. So it's not about height here. I have your pelvis elevated so that the hamstrings aren't straining and doing the work, that you can find the muscles in front of the thigh and activate them. So make sure you're squeezing the front of the thigh and you're not trying to kick the leg up to 90. It's not about height here. Good. Bend that knee in. Hold it in. Squeezing the front of the opposite thigh. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3, and switch sides. Setting up, dorsiflex the foot. Press the palms heavy. Reach the tailbone away. Sternum reaches for the back ribs press heavy into the floor. And we lift as we brace our abs up, 2, 3, and lower, 2, 3. Brace those abs, and lower, 2, 3. Not going for height, simply going at a nice slow tempo, engaging the front of the thigh to build strength. Keep thinking about your breath and how you can engage those lower abdominals to support the movement and keep the lumbar safe. The deeper these TVA contractions are, your transverse abdominis, the safer your low back will be. Last one, lift up, 2, 3, and lower, 2, 3. Go ahead and hug that knee in, extending the opposite leg out, holding here for a psoas stretch. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Bringing both feet to the ground, lifting the pelvis up. We're going to grab our lightest loop band and we'll bring it around the arch of the feet, lying supine, elevating the pelvis. Again, reaching the tailbone away, finding lumbar extension, reaching the sternum in towards the spine and the back ribs. Press heavy into the floor. Widen your collarbone. We're going to march here, dorsiflexing the foot, staying on your non-dominant side first, unilateral marching. Lift up, 2, 3, and lower, 2, 3. Exhale to lift, 2, 3. Inhale to lower, 2, 3. Taking your time. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. 4 more, and lift, 2, 3. And lower, 2, 3. Lift, 2, 3. And lower, 2, 3. Keep going. Close those ribs. Reach the tailbone away from you. Dorsiflex the foot. Brace your abdominal wall. Relax the chest. Tuck your chin to lengthen the back of the neck and engage the neck flexors. And finish up your last one. We'll go to the other side. Setting up with that dorsiflexed foot, being mindful of how the pelvic position is when you lift the leg up. I see a lot of people tuck their pelvis as the leg lifts up. That puts pressure on the low back. We're trying to extend the low back here. Reach the tailbone towards the bottom of the mat, away from your face, allowing that extension. And now moving on the breath, keeping the foot dorsiflexed the entire exercise. Are your arms still active? Press into the backs of the arms, the palms, the wrists. And when you do so, does your rib cage press out? Keep it soft, puddling the heart in. From here, we'll kick the band off. We'll extend one leg out long, internally rotating the leg in the hip socket. When you lift up, make sure you keep the foot dorsiflexed. Again, this is not about height, it's about building strength in the quadriceps. So lifting up on that 3 count, 2, 3, and inhale, lowering, 2, 3. Really dorsiflex the foot. So that inversion of the leg in the hip socket is going to allow you to access the psoas and the quadricep as you lift up. You're not going for height, you're going for contraction and strength work in your quadriceps and your hip flexors. And keep going, lifting, 2, 3, and lowering, 2, 3. Nice steady tempo. Here are your exhales. Sternum reaching in towards the back body. And let's slide the opposite leg out, switching sides after your next one. Setting up. Legs out, dorsiflexed foot. Inversion from the hip socket, turning the leg in, pigeon-toed. And then begin your lifts. Lifting up for 3 and down for 3. And every time you lift that leg, make sure your abs are braced. If someone punched you in the gut, wouldn't hurt because you're tight. Hear that breath, huh, every time you lift that leg. So it can be like you're fogging a mirror, it can be a stream of breath, or it can be a quick huh, but you hold the contraction regardless. So you sustain the lift of the pelvic floor. I prefer the, like you're blowing air out, fogging a mirror, because I can continue to hear it when I tend to hold my breath. But I do feel those muscles contract when I make that sound. So if that is what works for you, please do that so that you're firing the transverse abdominis to support the low back. Reach the tailbone away from you here. Be cognizant of your feet. Is the inner and outer edge of the foot flexing? So the baby toes should be flexing as much as the big toe. Shoulders should be on the mat, down the back, not elevating up near the ears. And finish up your last one. I want you to take your pointer fingers to the bony protrusions of the hips and guide them down to extension and back to neutral pelvis. 4 more of those. Exhale down to extension. Inhale, neutral pelvis. Exhale, extension. Inhale, neutral pelvis. 2 more. 2 and 1. Lifting the hips high in the air, sliding the ball out, setting it to the side. Coming up to sit. Good work.